Okay, let's get started here. Hi, everyone. Welcome back to Cafe Oleh. Welcome back from our short break for technical issues so that we could perfect and streamline the registration process and also make it one login link for this winter session, as we're calling it, from now until Pesach. In April, we will be coming to you on this same link. So thank you all for joining, whether you are brand new here or this is you are a longtime participant. Thank you all for joining. We have quite a lot of people on this call tonight. We had over 700 people sign up for Cafe Oleh this winter session. We currently have 230 participants on the call, which is absolutely amazing. My name is Jay. I'm a volunteer with Nefesh B'Nefesh. I myself made Aliyah with them over 15 years ago. And here at Cafe Oleh, we go over the everyday Hebrew you need here in Israel to succeed, whether that's reading bills, going grocery shopping and reading nutritional labels, keeping up with the news in Hebrew, everyday life that may or may not be taught in Ulpan when you're learning Hebrew here in Israel, or if you're not learning in Ulpan, maybe when you have studied Hebrew in the past, in high school or university, yeshiva, or previous times in Israel. Or perhaps you're not studying Hebrew at all and you want to get a taste of it. We're really focusing here on everyday Hebrew. So this is meant to be a supplement to what we would call more formalized language instruction, but we keep it very user-friendly. So we want to hear from you what topics you want us to cover. What are the issues that are affecting you in your aliyah to make it easier for you to fit into Israeli society, at least Hebrew-wise. Along the way, we certainly give cultural context to things. Myself, I'm not a human dictionary, so we're not going over words that you can easily look up in a dictionary. This is more about context, about things that you need a little bit more background to understand and to get through. For those of you who are new, those of you who have forgotten some ground rules, some housekeeping about how this takes place, and then some specific issues about tonight's topic before I announce it. So first off, if you have any questions specifically about the topic we're about to do, please write it in the Q&A button. You'll see at the bottom or at the top of your Zoom menu, there's both Q&A and chat. If you have a question about this specific lesson we're about to start, please write in the Q&A. You have questions, comments, concerns, criticism of me or anything else, please write that in the chat. There are, like I said, now 248 of you and just one of me. And I need to teach and facilitate at once. So thank you in advance for following that rule. Second, this and all of our previous other lessons will be up on Nefesh B'Nefesh's YouTube channel. So you can go back and watch this one. If you didn't want to take notes while I'm talking, or the vocabulary list I'm about to share, either with old school pen and paper or screenshot or whatever you would like, or you just want to repeat it, you're welcome to go to youtube.com, type in Cafe Oleh or Nefesh B'Nefesh. You will see a playlist of all of our previous ones, or you'll just see it come up sequentially. Hit the subscribe button on YouTube. You'll find out when our next one shows up. Really easy like that. Those are the regular rules. So again, Q&A specifically for this lesson, chat for questions or concerns about anything else. Tonight, we're going to start this session with probably our most requested topic, and I'm going to say our most contentious topic. Okay, this is, okay, sorry, the chat function is coming up as I'm talking, so bear with me, folks, as I'm explaining, and then by all means, ask your questions. Most requested topic, most contentious topic, which is health, right? We have a lot of requests week after week to go over health vocabulary, how to make appointments, what is a kupat cholim, how does the healthcare system work? And I get it. Even though we have done automated menus in the past, even though we've talked about the pandemic in the past, even though we've talked about health in the past, I get the concerns. Healthcare is not easy in any country, whether it's universal healthcare like here in Israel, whatever it may be. It's a new system. When we're not feeling well, we're feeling vulnerable, we're feeling weak. It's the least amount of patience we probably have in life. That being said, it's also the most contentious because probably a lot of you are not going to be happy with this class simply because I'm not going to answer your personal questions about your personal issues. I'm not a doctor. I'm not going to pretend to be. So this is not even WebMD. I'm not going to go through your specific ailments. So with that, I need to lay down some ground rules for today. First off, like I just said, sorry, let me just pull up my notes. Like I said, please do not share your specific ailments or your specific medical issues in the Q&A button. Okay, we call this TMI, too much information. I'm not a doctor. Even if there are doctors here in the audience, it's not their responsibility to answer your specific medical needs. Simple. I'm going to share with you in the chat box 3 really good quotes. I simply looked up because I keep hearing again and again, people are concerned they don't know the Hebrew, how to describe how they're feeling or anything like that. I simply typed in medical terms in Hebrew in Google. I got some of the best English Hebrew vocabulary lists I've ever seen, including from Nefesh B'Nefesh itself. Okay, so I'm going to share those links with you throughout the class today. In fact, let me do that now as I'm talking. Sorry, let me just pull that up. This is in the chat box I'm about to put in. Okay, you will see 3 links here in the chat box. One is from Tel Aviv University's medical school. One is from a nonprofit called the Shira Pransky Project, which is all about helping Olim navigate Israel's healthcare system. If you don't have the time to look up it now, don't worry, we'll make sure that it's in the description on YouTube in the next few days as this video comes up. And the last one is on Nefesh B'Nefesh's website itself under that Life in Israel section, Healthcare in Israel. 3 really good resources for Hebrew, or English to Hebrew, Hebrew to English vocabulary for medical systems. I went through the list. It's really impressive. Don't say you don't have the vocabulary, which is also why we're not going to go through all the major ailments and symptoms and things like that, because those words exist. You can look them up on your own. Okay. And so with that, let me just pull back up to my screen, make sure I got all of that up. Great. Before we get started with the vocab list, I'm going to actually do one last piece of what I would call, there we go, share, of housekeeping, which is I often hear from Olim, well, when I tried using the app for Maccabi or Klalit and I couldn't get English. And I'm going to stop you right there. I'm going to stop all 261 participants on this call. First off, I'm going to explain a little bit if you don't know what the words I'm talking about right now are, but if you already made Aliyah, you know what a Kupat Cholim is. We're going to explain that a little bit in a second. Please don't use the app. It's as simple as that. I know that many of you may not have the wherewithal with phones and computers and internet and so forth. Just because there's an app doesn't mean you have to use it on your phone. In fact, all 4 Kupot Cholim work very well on your phone. And if you use it on your phone, you can use Google Translate app to translate the website on. And even if you don't use it, you can go onto a regular computer. I looked on every of the 4 Kupot Cholim, went on to them, tried to translate them. They all worked relatively well enough to understand. Okay. So before, actually, I want to get into medical terms and then I want to get back to these screenshots. But just know, please don't ask about the apps, because if you're going to ask about the apps, I'm going to tell you just don't use them. Go to the website. All the websites are easily found just by going onto Google. I'm not going to put that up here. Again, that's something on those 3 websites I just shared with you in the chat. You can easily find. Okay, so let's get started with today's vocab. And let me make this bigger. So first off, as always, Hebrew is going to be in the center of the 3 columns with the dots and bars that we call nikud. Those indicate vowel sounds. In Hebrew, we write those as things. We don't have letters that indicate vowel sounds. As you get better and more proficient in Hebrew, those will go away. They're usually only used to make sure that you understand the pronunciation of a word, if it's spelled similar to another, or when you're first learning the language. Otherwise, they're not written out. On the right-hand side is transliteration. Left-hand side is English. On the far left is also gender when appropriate. I'm going to explain along the way, so don't think you need to cram all this down. or that I'm just going to read through it. You are welcome to screenshot the vocab as I'm going through it, or pen and paper. We're also going to get to some really important expressions that I'm going to say very slowly so you can actually repeat with me and follow along as which. So first, let's talk about two terms, the real general terms when we're talking about health. We have two words that are often used interchangeably but have very different meanings. The first word, row 2, is breut, or if you can't say the letter resh, but you say resh, briut. Briut is health. Okay, that's how we'll translate it in modern Hebrew as health. The other word you'll often hear is row 3, refuah. Refuah or refuah is often used talking about medicine as in the field of study, not medicine as what you take, as in medications, but medicine as the field of medicine. Okay? So, briut, refuah, both terms are applicable to this evening's class. Now we're going to start here, Kupat Cholim. As I indicated before, Kupat Cholim is where we start here in Israel with healthcare. In Israel, we have universal healthcare, and we have 4 of these, what we call Kupat Cholim. Kupot Cholim is the plural. This is a model that actually comes from 19th century Germany. If you recall, the state of Israel being founded, a lot of its initial institutions were heavily influenced by German culture. So one of the great examples is the Technion, the Institute of Higher Education in Haifa, was originally they taught there in German, right? A lot of our basics come from German culture here. Our system of education even is based on the German model, not the Socratic model of the UK and North America. Kupat Cholim also comes from Germany. It's a literal translation of the German term, which I'm not going to even bother breaking my teeth over, but it's a sick fund. It was built initially as a mutual aid association. And here in Israel, we call it a health insurance organization. If you want to think of it as an HMO, whatever makes you understand it, it is not health insurance in the sense of some other places that you may think of, certainly in other countries, certainly in the United States, where you have to buy into it. All Israeli citizens by law have access to a Kupat Cholim, to be a member of one of the 4 Kupot Cholim. If you are employed, part of your salary and part of your employer's salary, revenue goes to pay for the services in Kupat Cholim, and we'll get into what those services are in a second. If you're independent, if you're self-employed, you pay for that also. It's out of progressive tax, so it's based on your total income tax, how much you pay into the system. Okay. In Israel, like we said, there is universal healthcare as of the mid-1990s, and there are 4 Kupot Cholim. Klalit, which is the oldest and the largest, Maccabi, Leumit, Meuchedet. Okay, there are also the public hospitals. Some of them are affiliated with one or the other, but you can go to any of them should you need, God forbid, a hospital. Likewise with pharmacies. It used to be some pharmacies affiliated with one Kupat Cholim over the other. All like Superfarm and B here in Israel take all 4 health insurances. Okay, so Kupat Cholim, 4 of them. Let's talk about the different people who are involved and a little bit of the basic services involved. First is your Rofeh or Rofa Mishpacha. Rofeh is a male doctor. Rofa is a female doctor. Mishpacha is family. Literally a family doctor. This is the equivalent in other countries to a general practitioner. When you sign up with a Kupat Cholim, when you make Aliyah, you are not only assigned one of them, you pick which one, and the usual rule of thumb is you pick one that's closest or accessible to you, right? So if you're in a major city, you have your wealth of options. If you're in a smaller town, you should pick the one that other people around you are going to, or that's just simply close to you. Another rule of thumb to pick a Kupat Cholim is when you go to sign up, you ask them if they have an English-speaking doctor, although I will make this emphasized throughout this class and anytime future. A doctor in Israel, like a doctor in many other countries, but especially in Israel, has gone through enough training that their English is going to be great. Okay? The places that people find frustration with when it comes to English are lower down in the ranks, and we're going to get to that in a second. But a doctor, trust them, they're going to have English, but you can ask for a doctor who is either an Oleh themselves or has indicated that English is one of their fluent languages, and so they're more accessible. You're often asked this when you sign up with the Kupat Cholim when you make Aliyah. You can also choose, you can switch around between the Kupot Cholim once a year, right? So you have freedom of movement between them once a year to pick. Also, if you're in one of them and you move, or you want to move clinics or doctors, you have the right to do that as well. But your Rofeh or your Rofa Mishpacha is your general practitioner. This is the person you are going to go to when you need something, whether it's a checkup, whether it's a referral, whether it's tests, anything like that. They are the person to give you those permits. And we're going to get to those words in a second. Okay, they're going to be, you want to be on best of terms with your Rofeh or your Rofa Mishpacha. Next person down is an achot or an ach. Now, an achot also means sister, and ach means brother. In Hebrew, it also means nurse. Remember that only a few centuries ago, nursing was predominantly done by monastic orders, by monks and nuns, right? So, and nuns particularly are often called sister, or referred to as sister. So that tradition has stayed in modern Hebrew. So a nurse, a female nurse is an achot, and a male nurse is an ach. There are both in Israel. Gender is important. Okay, so a nurse is not necessarily going to be as fluent in English. They probably will be, but not as much as the doctor. They went through extensive training as well. If you're living in an Anglo-centric community or in a bigger city, chances are they will have English, but not always. And then lower down on the ranks, but no less important, is the mazkirot. Mazkirot is reception, is secretary, is the person who, when you call your Kupat Cholim to make an appointment over the phone, or you need to figure something out, they're the person you're going to talk to. They're the ones who are going to have the least amount of English. Okay, so when you hear fellow Olim complain about the lack of English in the healthcare system, this is who they're usually talking about. Sometimes it's the admin staff in a hospital versus the admin staff in a clinic. The point though is it's usually the admin staff. It's not the actual doctors. So we need to differentiate that. So when you're feeling frustrated about healthcare, we know who to place the blame at. Okay, so the mazkirot, as important as they are to making appointments, dealing with insurance issues, they are often going to not have the best of English. So patience, I will give you some important expressions to say to get through that. Okay. This is one that I just referenced, but is important to get through, is a mirpa'a or mirpa'a, row 10. Mirpa'a is a clinic. When you sign up for Kupat Cholim, you are assigned to a specific mirpa'a, which is why I said it's important to pick one that's easy for you to get to. When I made Aliyah more than 15 years ago, I lived literally next door to a mirpa'a of Klalit. So it was obvious I was going to pick that one. It was a no-brainer. They literally sat right next to me. And when I moved to Tel Aviv, I stuck with Klalit because the nearest one is about a 10-minute walk, and it's a very nice walk up Rothschild and through Kikar Habima. Very nice walk indeed. It's a nice, quiet, small clinic as well. Very simply to go. But this is going to be the place where your Rofeh or your Rofa Mishpacha sits, your general practitioner. This is also, by the way, if you need an on-call doctor. Oftentimes, let's say you're feeling ill and you need to see a doctor who has the capacity to give you a prescription. You're going to need to go to your mirpa'a and ask, is there a Rofeh or Rofa that can see you, an on-call doctor, right? So that is going to be your place. Often a mirpa'a has its own, next word, row 11, Beit Milkachat. It has its own pharmacy attached to it. Mine does here in Tel Aviv. Many others do as well. In addition to going to the major chains, right? Like Superfarm, like B, or the independent pharmacies around the country, the Kupot Cholim have their own, usually built into a mirpa'a. So if I wanted to just get a prescription, once I got a prescription, I just want to get it immediately filled, I could walk downstairs to mine, open the door, and get it there. Okay, a clinic will also have the achot or ach for tests, for blood tests, for any other tests that you need to get done. Bigger tests, things like EKG and x-rays, are not going to be done in your clinic. Okay, those are usually going to be done in a hospital. But just know a clinic is your first point of reference. It's where your general practitioner sits. The next level up from a clinic is what we call refuah dchufa, or as we say in English, urgent care. Right? This is somewhere between a clinic and a hospital. It's not necessarily an emergency room, and we're going to get to why in Israel you don't automatically go to the emergency room unless it's a real emergency. We have what we call refuah dchufa, urgent care. All 4 kupot cholim have what they call refuah dchufa. If you're in a major city, they'll have one of their own. If you're in a smaller city, it's probably regional based. It's probably not one per small town. Here in Tel Aviv, the 2 big ones of Clalit and Maccabi sit on the other side of the highway on Yigal Alon Street. And these are typified in that they're open later at night and they're open on Shabbat, right? The Mirpa'ah, your local clinic, is usually only open from 7 a.m. till 4 or 5 p.m. Right? So if something, God forbid, happens in the evening or on Shabbat, that's not where you're going to go because it's closed. And you're not necessarily going to need to go to the hospital, but you're going to go see urgent care, maybe to see if it requires hospitalization or not. You need to find where that is in your community. You can look that up or just speak at your Kupat Cholim to figure that out. Okay, but refuah dchufa is a good place to go. Those of you who have been to Israel before making Aliyah, or even as making Aliyah, you've also probably heard of the chain of urgent care clinics known as Terem or Terem, T-E-R-E-M. It's the same model, right? You go to Terem if you're a tourist or you have an issue that isn't necessarily requiring hospitalization, but it needs to be addressed. And from there, they will triage you and ascertain if you need to go to a hospital or if they can treat you on the spot. Same idea with the refuah dchufa of the kupot cholim. Okay, really 4 important things. They're all important, but these are probably the 4 most important things to understand how the Israeli healthcare system works. First one is row 13. Okay, row 13 is a Hafenaya. Hafenaya literally means referral, and in our case, it also means referral. When you need something, you always ask your doctor, your rofeh or your rofah mishpacha, for a Hafenaya. That could be for a blood test. We're going to get to that in a second. It could be for seeing a specialist. It could be for anything, that the general practitioner can't or doesn't provide, but another doctor could, a specialist doctor perhaps, or surgery or anything along those kinds, usually that the Kupat Cholim itself offers. You need a Hafenaya. You can't, for example, in Israel, just go show up at your Mirpa'ah, at your clinic, and ask for a blood test. It doesn't work like that. To get a blood test, you first need a Hafenaya from your rofeh or rofa, who will then put it in your tik. A tik is a file. And then once you have a Hafenaya, you can schedule an appointment with the achot or ach, the nurse, to have a blood test, because the nurse will administer the blood test at your Mirpa'ah. Okay, so Hafenaya is really important. You can't do most things in the healthcare system without a referral. And similar to a Hafenaya is what we call a hitchayvut, or it's known in its short form as a tofes shvaisre. Tofes is a form, F-O-R-M, like a sheet of paper, right? Shvaisre, the number 17 in Hebrew. Tofes shvaisre or hitchayvut, as I wrote out here, is a payment voucher. It's typically for services outside of one's HMO, outside of one's Kupat Cholim. So let's say, God forbid, you need an ambulance or hospitalization or private healthcare services, right? You need something that's outside the purview of your general services. You're going to need a Tofes Shvaisre, and that's basically a form that obliges the Kupat Cholim to pay for or to pay you back for the services you're about to get, right? And it's usually things that fall outside everyday care. That's a very important thing, because again, like a Hafenaya, there are certain things you just can't do and expect it to be covered, like even an ambulance. If you need an ambulance, you can certainly call it. If it's an absolute emergency, you call for an ambulance, but to work it back to make sure that it's covered, you will need this Tofes 17 through your Kupat Cholim. Two other important terms to know: Sal Briut and Sal Trufot. Sal Briut. Sal is a basket, a literal basket, like you hold either in the grocery store or picnic or however else you hold a basket. And Briut, we said, is health, right? These are the obligatory services that all Kupot Cholim offer. There are basic services. When you sign up for a Kupat Cholim and you pay that basic fee based on your salary, right? Or if you're retired, it's also measured as such. Sal Briut is the basic services that everyone is entitled to. That goes into types of medications that are subsidized, the amount of tests you can have, the amount of dentist appointments you can have, all sorts of different things. You can look all of this up. Okay, on top of the Sal Briut, you have two options to supplement it. One is that the Kupot Cholim themselves offer a supplement, right? So you pay to the Kupat Cholim a premium fee to get a premium services. That can be everything from a discount on travel health insurance when you travel abroad. That could be alternative medicine. That could be emotional therapy. That could be dental work. All sorts of other things are covered by this supplement. You can also get private insurance. In addition to the public insurance we're talking about here, there is private health insurance available in Israel, and that would cover all things that the Sal Briut does not. Okay. And the last one here is Sal Trufot. Sal Trufot, Trufa is medication. Trufot are medications. Each year, or at least on a regular basis, the health ministry and a panel sits, and they decide which medications are going to be subsidized by the state, anywhere from 50 to 90%. Right? It doesn't mean that if a medication is not in that, that they're not available in Israel. It just means it's not covered by insurance. So you're going to have to pay quite a lot out of pocket for it, as opposed to the copay, which could be a lot. Anyone, for example, who has needed antibiotics in Israel knows that the copay is like 22 shekel at most for a 10-day dose of regular antibiotics. Right? Same things as well. And each year it's published. It was actually just published a few days ago, the latest update to the Sal Trufot of which medications are included and not included. You can look it up if you're really interested, or just consult with your doctor if that's important. But just know that there are prescription medications that fall under Sal Trufot and some that don't. Usually the ones that don't are for very rare diseases, and very costly medications. It's not for everyday things that are usually found in the Sal Trufot. Okay. Let's keep going with some words. Really important, two words we're going to come to again and again is tor or tol and lehazin. Tol means queue. It also means an appointment. So when you're going to ask, and we're going to go through that word again, how to make an appointment with your doctor, where let's say you have a hafnaya, a referral, and you need to make an appointment with the nurse or specialist, this is the word you're going to look for. Tol. It means queue. It also means appointment. Think of queuing up in line for something. Same idea here as meaning appointment. Okay. And similar to that, although not directly related, is the verb lehazin. Lehazin means to enter or input. If you recall when we did our lesson on automated menus, and you can watch it on YouTube for those who forgot about it or haven't seen it at all, we went through automated menus, and this verb comes up again and again when you're asked to put in your personal details, whether it's your Teudat Zehut, your national ID number, or your birth date, or whatever it may be. This is the prompt that's going to tell you to do that. Na lehazin, right? Please enter or please input whatever data is there. Very important verb to go. I'm going to actually break here, and I want to show you if you can see this. Right? If you see here, this is Klalit's website, and on the right-hand page, you can go into your personal teak, right? Your personal medical file. And it gives you two options how to log in, either with a password. If you don't have a password, no problem. As you see here, it says Mispar Teudat Zehut, put in your national ID number, and then it says Yesh lahazin et hatavim. I'm on the right-hand side in the center of the page of this screenshot, and it says Yesh lahazin et hatavim. Please, you need to enter the characters listed below, right? This is a CAPTCHA security code. You type in W5NB4 in this case, but it obviously will be different when you do this if you're on Clalit. And then there's a green button that you'll scroll down to, press it. You will get a SMS to your phone because your phone number is listed with the Kupat Cholim. You'll get a code that you're asked to put in, and then you'll have access to the website. The same thing exists for all the other ones. Here's Maccabi, right? Maccabi, top left hand of Maccabi's page says Knisa LeMaccabi online. And once you click on that, you get this page on the left hand side here. Knisa LeZor Ishi, entrance to the personal section, i.e. your medical file. And you have an option again, Knisa Im Sisma, entry via password, or entry with a code Chad Pami. Code is a code, Chad Pami, one time. Right, so same model, just as with Clalit. You're going to enter where it says Taf Zayin Teudat Zehut, your Teudat Zehut number, Tarikh Leda, your birth date. And remember, in Israel, like most countries in the world, with the exception of the United States, we go day, month, year. Right, so you're going to write it in there. It actually is going to be a calendar that pops up, so it's even easier. And you're going to press the blue button for Hamshech, continue. Okay. On Leumit, it's the same thing, right? Left-hand side, Knisa Le-online, right? Teudat Zehut, your national ID number, Telephone Nayad, your cell phone number, if you're with Leumit. Meuchedet, same exact thing. Top left-hand page, Ezor Ishi, personal section. You're going to log in the same way. Im Asisma or Im Chad Pami. Very simple how to do this. Okay. So let's move on. Okay, so we went through those pages, really simple. You're going to look for that toll, right? If you need to make an appointment, you're going to look for toll. If you're going to look for anything else, again, open it on your website, on a computer, or on your phone, and use Google Translate, and you'll be able to access the vast majority of the website. It's very easy to use if you're struggling with the Hebrew. Okay, I promise you Google Translate will work on the website versions of it, not on the mobile app version. So just put aside the app, even erase it. It won't erase your medical information. It's all saved in the directory of that Kupat Cholim, totally computerized. Don't worry about that. Let's get to some symptoms, right? As you're going to describe to your Rofeh or your Rofa or the Achot, or even the Mazkirut, the reception, and then let's get to some other important words. So again, I didn't want to get too far into words that you can easily look up, but these are the classic words. I think everyone is looking for those words in any language when they're not feeling well and they need to describe to a doctor how they're feeling. It's especially hard as an immigrant, right? Oleh and Olah are nice terms, but we're really immigrants. And that comes with a fraught array of things, including culture shock, including language issues. So all the better you have some basic words. Again, there are many more on the links that I shared with you before that you will be able to see. These are the basic words that we use to describe how we're feeling. If there are more, don't judge me, just look them up on yourself. Really easy like that. And again, those resources online have them. So let's start with some basics. Tasmin. Tasmin is a symptom. It comes from the same word as sign or a symbol, siman. So tasmin is a symptom. Ke'ev is pain. Simply put, pain. Nefichut is swelling. I put here swollen, but oftentimes we're talking about something that is nefichut, there's swelling in something. If you just want to say it's swollen, you can use the adjective, which is nefucha, but usually you can just say nefichut. There's swelling. Okay, I put swollen here. I'm actually going to just change that. Megared. Megared is itchy. Okay, it can also be scratchy. In this case, it's itchy. Itchy as in your skin or something along those lines. Itchy meaning scratchy, but particularly with your throat, is tsarud or tsarud. So if you have a scratchy throat and you're afraid it might be strep throat, tsarud is the word that you want, scratching your throat. It's dry, especially dry now in winter here in Israel when it's not raining. So often that's a tasmin that many people have when they're feeling ill. A symptom that they're having is that they're scratchy, tsarud. Okay. General term for infection is daleket, right? Daleket re'ot is infection of the re'ot, which are lungs, which in everyday term is pneumonia. Okay, daleket you can have obviously in many different places, a daleket, an infection. Poem is throbbing. Okay, so if something hurts to the point that it's throbbing or it feels like it's throbbing, this is the word you're going to use to describe it. Pricha. Pricha is a rash. It could be a rash of any kind, anywhere in your body. It is related to the word perach, a flower, or lifroach, to flower, to blossom. The idea, think of a rash, right? It's this red thing that slowly gets bigger and puffs up on your skin. That's where this term comes from, pricha. Last but not least, in the lovely short medical terminology I put up here is plita. Plita is a discharge of any kind, of any source of anything that a body can, discharge, but it also means discharge in the general sense, plita. Okay, let's get to some more words. Aha, very good words here. Okay, and then we're gonna get to some expressions that I want you to practice with me. So first here, tipul, row 31. Tipul is a treatment. It could be any kind of treatment, right? The doctor prescribes medication, that's a treatment. Tipul could be of anything. It could be psychological treatment. It could be alternative medicine. It could be all sorts of different things. Is a tipul. That's a general term that's going to be used a lot. 32 and 33, mirsham and lelo mirsham. Two very important words. We talked about sal trufot before, right? That medication basket, those medications that are subsidized by the state or not. Mirsham is a prescription, right? So a medicine that needs prescription will have mirsham to it. And then you have medications that are lelo mirsham, without a prescription. I don't want to call this over the counter or OTC because there are enough non-prescription medicines that are literally held behind the counter in a pharmacy. The term over the counter was brought because certain medications didn't need a prescription and thus didn't need a pharmacist to be there. So in a super farm or in other drugstores in Israel, you will often see these separate from the pharmacy nearby, but you don't need the pharmacist's help to get them. Those are things like basic pain relievers or low strength antihistamines or, antacids or things like that. Think what are over-the-counter medications in your country. Chances are they're included there, but there are ones that are not included there. For example, larger sizes of pain relief that don't need a prescription are usually behind the counter. Certain types of pain medications are behind the counter. You will know when you talk to your doctor which ones are there, which ones are not there. You can also strike up a conversation with your local pharmacist, whether it's in Superfarm or an independent one or attached to your mirpa'at, to your clinic. Okay, but mirsham, lelo mirsham, it'll be very clear when you go to the doctor and they tell you what course of medication to take, if it needs a mirsham or lelo mirsham, because they will print out a prescription for you, right? They will print out the list that will be that you need to take or you are recommended to take. Another really important word along with tipul is bdika. Bdika is literally a check. It comes from the verb livdok, which is to check something. It's best translated as test, right? This isn't check as in a check on a piece of paper. This isn't check that you write out with monetary value. It's not check that you get at the end of a meal. It's a check as in a medical test, right? So if I wanted to go for a blood test, I would ask for a bdikat dam. Dam is blood, bdikat dam, test of blood, blood test. Okay, test of any kind is going to be a bdika, right? We all know this very well here in Israel with regards to the pandemic. Bdikat antigen or bdikat PCR, same thing, a test, either an antigen or PCR test. This is the word that we use, bdika. It's any kind of test that's needed. Okay, along with those tests, a very important one to be responsible adults, bdikat machalot min. Bdika, we just said, is test. Machala is a disease or ailment. Min is sex. Put it all together as one long compound word in Hebrew, which stands for an STI or an STD test. Okay, so if you need to schedule that, that's what you're going to be asking for as well. Bdikat dam is a general blood test, and so forth. You can look up all the other words that you need, specific ones on your own, but those are two obviously very important ones. Two other ones that are very important are tkufati and shigrati, two important adjectives when you're talking about health-related issues, right? One is tkufati. Tkufati is the adjective of tkufa, which is a period of time. So tkufati is periodical, right? Maybe you need to come to the doctor every so few months to run a set of tests of dikot. This is a word that you're going to need to recognize in your list or when you're asking for these things, as well as this other word, shigrati. Shigrati, row 37 here, is the adjective of shigra, which is a routine noun. Shigrati is just routine as in an adjective. So a bdika shigratit would be a routine test, right? I need to come in for a routine test, or I need to come in for a bdika tkufatit, a periodical test, right? Both of these things indicate that they happen on a regular basis, and you'll check with your doctor how that's documented in your specific teak, but very important things. Okay, leading up to the following 2 points, I want you all to take a deep breath. I see I got a lot of Q&As and a lot of chat things there, so I want you all to take a deep breath, because the following 2 things you're going to repeat after me or repeat with me as I say at home. 2 very important sentences that are going to be your key to surviving Israeli healthcare. Let's start with the first one. Okay, let's say you didn't do well with the automated form online. Let's say you just need to see a doctor, or you wanted to call and break your teeth, perhaps with the maskirut, the admin of your malpeah. Okay, and I want to say very simply to them, I want to make an appointment with my doctor, with my general practitioner. If you are a man, if you identify as male, you're going to say the following thing. You can follow along in the Hebrew. The Hebrew is written exactly the same for male and female without the nikud, which is why I left it without the nikud here. Okay, so someone who identifies as male would say, Ani rotze likboa tor im rofe mishpacha sheli. Okay, say it all in one line. I broke it down there, but I'm going to say it quickly and then do it again. אני רוצה לקבוע תור עם רופא המשפחה שלי. Okay, I want to schedule an appointment with my doctor. Okay, now רופא or רופאה will change based on the gender of your doctor, but this is the sentence that if you identify as male, you will say, אני רוצה לקבוע תור עם רופא המשפחה שלי. Okay? Likboa tol, that is the phrase that means to schedule an appointment. Okay, you're not going to translate it literally. It's likboa tol. We've talked about this verb quite a bit in the past. Likboa means to affix something, and tol, like we said, is both a cue and an appointment. To make an appointment when you're asking to make an appointment is likboa tol. When you are making an appointment on your own on the website, you're often going to see zimun tor. Zain, Yud, Mem, Vav, Nun, Zimun, Tor, it means the exact same thing. But when you're asking to make an appointment verbally, right, just as we are now on the phone with the mazkirut, you're going to use the verb likboa. They mean the same exact thing, scheduling an appointment. Okay, so as a male, you would say that. As a female, you would say ani rotza likboa tor im rofe rofa mishpacha sheli. Okay, again, rotza is the feminine. I want, and then you need to change rofe or rofa depending on the gender of your doctor. So again, for male, ani rotze likboa tor im rofe hamishpacha sheli. I want to make an appointment with my practitioner. Female would say ani rotza likboa tor im rofe mishpacha sheli. Okay, and when you say that, usually they're going to ask you immediately, ma shem harofe shelcha, to a man. What is the name of your doctor? Shelcha is to a male. And if it was to a woman, they will ask you, ma shem harofe shelach. What is the name of your doctor, meaning you, female? Okay, and then you'll tell them the name of your doctor. You'll know the doctor's name when you sign up at your Kupat Cholim, if you haven't already. Okay, very important, basic, but very important sentence to know. Now, the next one, oh, we actually have three, even better. Did I put this one here? Let me just make sure. This is the same idea. I didn't put the Hebrew here, but I'm actually going to write it really fast. Bear with me 1 second. Okay. Another one very important. Let's say you've gotten the Hafenaya, the referral. Let's say you need to see a dermatologist, right, for a routine skin test, because it's a very important one, melanoma and so forth. This is gender neutral. One of the great sentences that you will have. This does not need to conjugate based on who the speaker is. So for all of you, you can say, repeat with me, yesh li hafnaya le, you'll fill in the blank of what it is, and you'll look that up on your own. Efshar likboa tor. Yesh li hafnaya le. Efshar likboa tor. I have a referral for a skin doctor. Can I make an appointment? Okay, so again, you're calling your Kupat Cholim to schedule an appointment based on the Hafnaya that you've gotten, based on the referral that you have, right? You got a referral to see a specialist. You need to go ahead and make that appointment. Again, if you're doing this not online, but with someone on the phone. And then this one, again, I want you to turn off your cell phones. I want you to silence the kids, the pets, everyone else. I want you to repeat this question, this phrase diligently with me, and then bookmark it afterwards on YouTube, because anytime, instead of complaining that someone doesn't speak speak English, just because there's an English option, you're going to say the following very polite request. You're going to ask, rather, the very polite request. Okay? Kashe li ledaber be'ivrit. Yesh im mi ledaber ba'anglit. Okay, I'm going to say it as I would normally say this. Kashe li ledaber be'ivrit. Yesh im mi ledaber ba'anglit. Okay? Kashe li ledaber be'ivrit. Yesh im mi ledaber ba'anglit. Simply means I have a hard time speaking Hebrew, or it's difficult for me to speak Hebrew, or as it says here on the left, I don't speak Hebrew well. All of those are appropriate translations. Is there someone with whom I can speak English? Or is there someone who can help me in English? Or any of those sentences, okay? If you get stuck, not just with your Kupat Cholim, not just with the electric company or with your municipality, wherever it is, this is a very important sentence, and it's phrased for you in the most polite way. I can make it even more polite, but we don't need to be over the top here. This is very polite. So when you get frustrated, and I know you all do, we all do as Olim get frustrated because we can't speak. as in the level that we want to in Hebrew, or Hebrew's failing us, this is what you're going to ask. It's whether it's with your Kupat Cholim or in any other context, this is what you're going to ask. And hopefully there will be someone there on hand who can help you. Okay? קשה לי לדבר בעברית, יש לי מי לדבר באנגלית. Very nice way to ask, can someone help me in English? If no one there, if you are having a trouble time, not yelling at them, not cursing them out. Why do you have an English option in the first place? A very polite way to do things, because it's worth being polite, even when you're frustrated. Okay, one more thing, and then actually two more things I want to get to. One is something I've talked about before. This is a really good way to understand how Hebrew works. Hebrew is a very mathematical language. We talk about this a lot at the start of our session. It's really important, winter session, it's really important to say this again and again. Hebrew is a mathematical language. Hebrew is very, very logical. It is certainly more logical than English. It's logical than many other languages. It is essentially 8th grade algebra. So if you have a love-hate relationship with math, I certainly do. 8th grade algebra wasn't my favorite. But I can handle this, because what it basically is x plus y equals xy. What do I mean by that? Every Hebrew word is created with a shoresh or shoresh. It literally means root, R-O-O-T. And usually Hebrew words are comprised of 3 letters, sometimes 2, sometimes 4, that have a general meaning. When you apply that general meaning, that shoresh, into what we call a mishkal, a template that is full of those dots and bars indicating vowel sounds, maybe a couple helper letters, we get a specific word, because that template also has a meaning. Let's look at an example when we're talking about medication and health here. Row 42. There is a mishkal that has to do with diseases, right? We have ones about places, we have ones about occupations, we have all sorts of different ones. Excuse me, but one that we have is for ailments and diseases. And it sounds like this, a-e-et, where the shoresh, that 3 letters, get applied to, as you see here, the first 3 letters of the words. The word ends in the letter taf, and the vowel sounds that approach it, that go with it, are a-e-et. Let's take an example of a word we just did. Infection, daleket. Okay, dalid lamed kuf has to do with something that is, you can think of it like the verb lahadlik, to light, right? As in lahadlik ner shel Shabbat, that many of you probably know, to light the candles of Shabbat, the blessing that we say on Shabbat evening. Also means lahadlik, as in to turn on an electrical appliance, but it also comes from the same words for oil and gas, and something that's flammable. So something that is also liquid, that's movable, that things like that. So daleket is infection. Here's one that better illustrates it, kalevet. How do we say dog in Hebrew? Kelev. We take the word kelev, we stick it in this mishkal, this template, and we get the word kalevet. Kalevet, disease of the dog, rabies. Let's take another one, sukeret. The word for sugar in Hebrew is sukar. The disease of sugar, sukeret, diabetes. A more figurative one, but no less taxing, no less painful, nayeret. Niyar or niyar is paper, right? Like regular pieces of paper. Nayeret is the disease of paper, i.e. paperwork. There are many other diseases that are like this. There are many diseases that don't follow this pattern, but this is a classic pattern when it comes to diseases. And it's a great way to understand how Hebrew works. All Hebrew words have a mishkal and have a shoresh. You can understand words infinitely when you figure out both. And once you start using Hebrew more and more, you will get the patterns, you will get the shoresh, and you can make up words even on your own very easily. Nayeret is a great example. It's a very modern word that they thought up of. And it's a great explanation of paperwork being a burden, being an ailment, not something that anyone really looks forward to. Okay, last but not least, before I get to your questions, because I see we have quite a lot in the Q&A, are some general expressions when it comes to health. Now, we have quite a lot. Probably some of this is known to some of you. Probably some of you don't know it, or you don't know the subtleties in some of these. So let's go through these. It's very Jewish, it's very Middle Eastern, it's very human to wish someone good health or quick recovery. Some of these mean those in different contexts. Let's go through some of these together. The first, row 48, labriut or livriut. You will hear both being pronounced and both are grammatically correct. In modern Hebrew, you can either say labriut or livriut. Both of them mean to your health, to one's health, and they're said after someone sneezes. Right? Someone sneezes, labriut. You can use these obviously in any other context that you're toasting or cheering or wishing someone good health. Labriut or livriut. It's the same idea, by the way. Livriut, if you think that it's wrong, it's like lechaim. Lechaim, just like livriut, is indefinite. There's no definite article, which in English is the. Both of these are perfectly all right. Everyday language, everyday Hebrew to say to someone, feel better, or get better soon, or feel well. Targish tov, you would say to a man, targish tov, or to a woman, you would say targishi tov, targishi tov. Male, targish tov, targishi tov to female. Okay, targish comes from the verb lehargish, which is to feel. And tov, even though it means good, in this case, it's also an adverb, well or better. Okay, so talgish tov, talgishi tov is what you would say to someone. Let's say that someone is in bidud, they're in quarantine because they tested positive. You would say to them talgish tov or talgishi tov, depending on their gender, feel better. Perfectly all right, no anything behind that, but it's a very nice way, obviously, to say to someone that they should feel better. This one probably many of you know, refuah shlema. Refuah shlema comes directly from Jewish tradition. It has a more religious connotation behind it. This isn't necessarily what you're going to hear from a non-observant Israeli Jew or a non-observant Israeli, perhaps not Jewish. Refuah shlema is very Jewish. Okay, so have that connotation. If you're wishing someone get better soon, or may you have complete health or full health, as this more literally translates, just be sensitive to whom you're saying it. It's not that someone will be offended if they themselves are not observant. They just may not understand what it means because it's not necessarily applicable to them if they're not observant. But when in doubt, you're welcome to use this. This next one is more modern Hebrew. It's the same feeling. It's just a little bit more updated and doesn't have the religious connotation behind it. Achlama mehira. Achlama comes from the verb lahachlim, which is to recover. Achlama is recovery, and mehira means speedy, right? So achlama mehira literally translates to may you have a speedy recovery. In regular English, get better soon. Both of these, refuah shlema and achlama mehira, both mean get better soon. It's just one has more of a religious connotation than the other. Okay, and then the last one before I break for questions. Tiyeh bari to a male and tiyeh bria to a woman. Now, tiyeh bari and tiyeh bria both mean may you be healthy, but they don't also. This is equivalent to the Yiddish expression sei gesund, but it's also used like sei gesund in Yiddish and its equivalents in Jewish communities in the Middle East and North Africa as both a blessing and a potential curse, right? If you wish someone tiyeh bari, there's a lot of context that goes behind that to say whether you're being sarcastic or not, meaning I really do hope that you are healthy, or you blew me off because you said you're sick, or I don't actually believe that you're sick, or I don't really, care enough about you. May you have your health because you really need it because you got a lot coming to you. Okay, so if someone says to you, tiyeh bari or tiyeh bria, if you are of a superstitious nature, just be, do whatever you do to ward off the evil eye. This is not one this one requires a lot of context. I've been told by an elderly gentleman when I was volunteering at a senior citizen home here in Israel, in Beit Shemesh, tiyeh bari, after I was called away to work at the desk. And it wasn't a positive thing to be told by an 80, 90-year-old man, Tia Bari, because it was like, I've been around the corner, guy. Don't mess with me by pretending you have work, even though I was called away. So Tia Bari, Tia Bria, as much as it sounds like it's a good thing, it's not necessarily a good thing, and you will hear this just as much as the other ones. Obviously, it's a very different connotation potentially. Okay, I want to break here because we have a lot of Q&A, and I want to get through some of these in the little bit of time I have left. Okay, I see a lot of initial questions by people who are brand new to Cafe Oleh. I've answered most of those already. This is a frontal lecture for those of you who are brand new, because there are, again, 247 of you and just one of me. So yes, your microphones are indeed muted. That's just the way of things. We are going to be offering more conversational things and many more Hebrew options here at Nefesh B'Nefesh. Stay tuned in your emails for many more, but that is the format here. Anonymous asks, is the Zayin silent in no, mazkirut, the word for reception or secretary? Let me pull that back up here. Here it is at the top, row 9, mazkirut. Sorry, it's just because the letter Z on the keyboard often has a problem. It's usually the first one to go. Let me just get that out. Mazkirut, thank you for pointing that out, Anonymous. Ruth and John Grabinar, how do you say on-call as an on-call doctor? Very good question. Let me write that here at the bottom, and I'm going to say it as well. Okay. Rofe Toran. Rofe Toran. On-call doctor. If you need to see a doctor, and let's say it's something not urgent, but you need to see a doctor today, and you go to your clinic and your specific doctor is not available because their office hours aren't there or they're not in, you're going to ask the mazkirut for the Rofe Toran. Rofe Toran is the on-call doctor, or Rofe Toran. Okay, very important, good question. Thank you for asking. Okay, I see a couple questions about Terem. Terem, folks, is another form of urgent care that sits between your mirpa'ah and a hospital. You can go to their website. Just type in Terem into Google. You will see where those are throughout the country. Both internationals and Israeli citizens can go to Terem. Okay, but it's urgent care. Think of it like a first aid center that has a little bit more sophisticated services available. So if you sprain your ankle, you can go there instead of the emergency room. Ellen asks, teek, you said this is a file. Is this the same word teek as purse? Correct. Teek is a file. It also means purse. We're very conservative with the Hebrew language. Phyllis asks how and where you get the Tofes Shvaisle. You will get it from your doctor and from your Kupat Cholim. Simple as that. You cannot just sign up for a Tofes Shvaisle. You need to be screened by your doctor for specific services, and they will help you with that process. Are there any differences for a senior citizen compared to non-senior citizens? Nope. All Israeli citizens are entitled to universal health care through a Kupat Cholim. Very simple. Susan, is the Sal Trufot mostly generic meds? Great question, Susan. Not necessarily. The Sal Trufot is about the types of medications that they deal with. Sometimes it is the generic version, and sometimes it's the name brand, and sometimes it's both. It really depends. You can see the full list on the Health Ministry's website. It's in Hebrew, obviously. But they do, when there is generic versions available with it, it will be listed. Okay. Carl asks, will the pharmacies fill your prescriptions while you wait, or do you have to come back? They will fill your prescriptions while you wait, Carl. I know that in other countries like the United States, you have to come back. You go with your prescription. It'll be a piece of paper to the doctor. You will also come with your magnetic card. You get a credit card size card that you will use to swipe in the machines when you get to your milpa, and they'll also ask for it at the pharmacy where your prescription and your medical info will be. You'll give it to them, and they will tell you, do they have it on, do they have it available or not? If they don't have it, it usually means they don't have it. They'll tell you to go to another pharmacy. They'll even help direct you to another pharmacy. But they'll do it as you wait at the counter. You don't need to come back. Zilla asks a great question. How do you address the doctor? You can simply say Rofeh or Rofa, or you can simply just refer to them directly. Remember, Hebrew, more importantly, Israeli society, we don't have a lot of etiquette when it comes to seniority and titles and things like that. When you're talking one-on-one with someone, it's clear you're talking one-on-one with them. That's how Hebrew works. So you don't need to use honorifics in the same respect. Wendy, can one get private insurance with pre-existing conditions? I honestly don't know, Wendy. You can get your universal healthcare with pre-existing conditions, 100%. Private insurance, I personally don't have. It's around 1/3 of Israeli citizens have private insurance in addition to their state insurance. That's something to look up on your own. I just don't have the information. I would also advise you to look at those websites I told you about before, the Shira Pransky Project and Nefesh B'Nefesh. Okay. Irene asks, can mean be used for kind, or is it only for gender sex? You're right, Irene, it's both. Mean, mem, yud, nun means both gender as well as type or kind, as you said. Linda, yes, you asked about the types of diseases. It's up right now. Feel free to screenshot that. Anonymous, prescription refill from an American doctor. Do I have to start over with an Israeli doctor? Great question, Anonymous. If you are an Israeli citizen, I believe the answer is yes, but don't quote me on that. If you are here as a tourist, you usually can get it refilled, assuming that you have the prescription and all its details written out or printed out ahead of time. That's as far as I know. Please don't quote me on that because, again, I'm not a doctor. But if you are an Israeli citizen, that is not something that transfers so easily. You will need to speak with your doctor. Maybe your doctor will allow you to do it, in which case they just put in the paperwork there. But that is something you need to speak with your Rofeh or your Rofa Mishpacha. David asks, are there any medical referral organizations that help you choose good doctors on specific issues? Again, if you're going through your Kupat Cholim, right, they have their own network of specialist doctors. So unless you're using private insurance, if you have Klalit, they're going to refer you to a dermatologist who takes Klalit insurance. If you're using private insurance, that comes with its own network, right? All the 4 Kupot Cholim have their own networks of specialists. So that's also an important thing to look at when you're choosing a Kupat Cholim is accessibility, English, and if there are specialist issues that you need to see who is included in that. Great question. Phil, emergency room is a word you can look up on your own, which is why I didn't put it here, but the word is cheder miyun. Okay, cheder miyun. Beit Cholim is a hospital. Cheder miyun is emergency room. Those 2 words are easily available in any dictionary, even Google Translate, as terrible as of the surface as it is, as well as those 3 websites I posted before. Linda, I'm thinking you mean the adjectives. So I'm putting that here. Just a few more questions because unfortunately I do need to go. And I know this is a very important topic for many of you, which is why I'm giving a few more minutes here. May, how does dental system work? Great question, May. You need to go through your Kupat Cholim. Again, your Kupat Cholim allows you X number of visits in a given calendar year. You need to specify that with them. Also based if you have the supplemental insurance or not. Each one is different. And the amount of times you get a cleaning versus a checkup. In Israel, a cleaning and a checkup, if you're going through your Kupat Cholim, are 2 separate appointments. Not like a doctor's dentist visit in other countries. They're 2 separate appointments, a cleaning versus a checkup. If you're going through a private Private doctor, that may be completely different. You need to check with the dentist specifically and your kupat cholim. All right. Irene, are all doctors in Israel required to take kupot insurance, or they refuse? Irene, you need to think about this separate. You go through the medical system through your kupat cholim or through your private insurance. You don't approach a doctor directly unless you potentially want to pay out of pocket, right? That is the way it works. You go through your healthcare service to find a doctor. And again, all of them have comprehensive lists of doctors who are affiliated with them. If you go to a doctor and they don't have it, you can certainly speak to your kupat cholim. Maybe they will be able to issue you a Tofes 17. Remember that form that allows for copay for out-of-pocket services, out of network services. Okay. I see we have a bunch of people asking about the websites again, so I'm going to post it again one second time in the chat. And I see a lot of people now following my instructions and writing questions in the chat that were meant for Q&A. I'm sorry we're running out of time. Please, for next time, write those in the chat, but in the Q&A, excuse me, but we do have these recorded, so we'll be able to go back if there's anything pressing to go through them. Let me just write these again in the chat. There are indeed 3 different ones here. It's just the way that they come out. Let me see if I can separate them. There are 3 different websites that I'm now pressing enter into the chat. And I will ask specifically for the webmaster to put up these 3 websites when we post this video. And with that, we need to break here. Toda rabah to everyone. Thank you all so much for joining. Whether this was your first time or a repeat, we will see you back here, Monday, 8 p.m. next week for another topic. Next week, we are going to be talking about everyday idioms and expressions that you need in Israel that are used in every conversation you'll ever have in a given day that don't translate very well. So if you've ever heard an Israeli say things like what suddenly, or on the face, or standing in the times, with that very stereotypical accent, I'm going to explain all those expressions and even more next week. So again, toda rabah, thank you all so much, and leitrot, see you all soon.